charts that need to be filed will be located on the metal rack in the front of the room. Take the chart over to the shelves on the left side of the room and find where the chart belongs according to alphabetical order. The labels on the edge of the charts are there to help you file. The first letter is the first letter of the patient's last name, the second letter is the second letter of the patient's last name, and the third letter is the first letter of the patient's first name. Once you have found the right spot for the chart, place it on the shelf. If there is ever a chart with paper still attached to the front of it, leave it on the metal shelf. Next, we will talk about pulling charts, which is finding charts and getting them ready for a future appointment. When there are charts that need to be pulled, you'll be given a list with the patient's name, the time of their appointment, who they are seeing, and what their appointment is for. If the name has a check mark next to it, someone has already found the chart. If the name has another name next to it, this means that a staff member is currently using the chart, and it is on their desk. The first place to look for a chart is obviously the shelves located on the left side of the room. Once you have located a chart, be sure to mark a check mark next to their name on the list. The next place to look would be on staff members' desks. Do not remove charts from a staff member's desk. They are currently using them. Instead, write the name of the staff member whose desk the chart can be located on the sheet. Instead, take a scrap sheet of paper and write the appointment date, time, and who it was with, and attach it to the front of the chart. Then return the chart to the desk where you found it. Another place you may find a chart is on the shelves on the right side of the room, indicating that the patient has an appointment with another provider. There will be an appointment list located behind the tab indicating the provider's name. Use the date on that list to ensure that this appointment is before the date of the appointments that you are pulling for. Then write the date and provider of this appointment on your appointment list. Similarly to when you found the chart on the desk, write a note of the appointment provider, date, and time of your appointment list and put it on the front of the chart. So once this patient is done with one appointment, their chart is already ready to be put in the next appointment stack. Once all the charts on your list have been found, it's time to stuff them with the proper paperwork for the appointment. Everything that you need will be located on the desk under the mantle in the chart room. For appointment lists in which the provider is Japonica or Dr. Gotcha, you will use these progress notes located on the right shelf. For appointment lists in which the provider is anyone other than Japonica or Dr. Gotcha, you will use these progress notes located on the left shelf. With either progress note, insert them on top of the yellow vital sheet in the chart. On the progress notes for Japonica and Dr. Gotcha, you will need to fill out the name, date of birth, and age of the patient, as well as the date of the appointment, with an ink pen. On the progress notes for all other providers, you will fill out this bottom section with the name and date of birth of the patient, the date of the appointment, and who their provider is. For blue-colored charts, you will also need to add the bright yellow HOPS form located on the bottom of the left shelf. Fill out with an ink pen the name, date of birth of the patient, as well as the provider's name and the date of the appointment. Insert loosely in the front of the chart where the provider will easily see it. If there are no charts that need to be filed or pulled, you can make new charts for future appointments. All the tabs and empty charts that you will need are located on the shelf at the back of the chart room. Begin by pulling a blank chart. Everything else that you will need to make a new chart is located at the front of the chart room under the mantle. This includes 2 dummy charts, one blue and one tan, that you can use as models when you're making a new chart. Simply follow the order of the dummy charts of the paperwork and tabs to make a new chart. This is the same for the blue chart as well, as they are set up a little bit differently. Be sure to follow the correct colored chart. If you cannot find the tab that you are looking for at the back of the room, feel free to use the labels that are made at the front of the room and attach them to any of the files located at the front of the room. Be sure to add one of the expiration stickers to the front of the chart that you have made. When your new chart is complete, you can take it to the back of the room and place it on the back shelf next to the other new charts. If you run out of the proper paperwork, there is a copy machine and the colored paper out in the hallway outside of the chart room. If you get confused or have any questions while volunteering in the clinic, please always be sure to ask a staff member. We want to be sure that we do things correctly for our patients. Thanks so much for watching and happy volunteering.